Almira, thank you for joining us. Can we test you on the Russian channel, please?
Yes,
I can.
thank you.
Thank you. We can hear you. Thank you, Almira. All right, well, we will go ahead and get started, everyone. Thank you so much for joining us today for our provider information session. It is the last webinar that we will be hosting this year. So again, we really appreciate you being here with us tonight. For this webinar, we have a few topics and we'll be covering those in a few slides. But first, we do want to make sure that we have people who need interpretation who can join the right channel. So if you need interpretation, please go ahead and in the next slide, you can see the visual. So at the bottom right-hand corner, you will see the interpretation button, just like here. Si usted habla español y necesita interpretación, puede usar el icono del globo y ahí va a poder escuchar la interpretación en español. So we'll give a minute for people to please join their interpretation channel. We have Vietnamese available, Russian and Spanish tonight, as well as our ASL interpreters, and we will do an attempt here for closed captioning as well. Perfect. And with that, it looks like closed caption is on. We will move on to our agenda items. For today, we will be doing a quick check-in again on COVID-19. As we know, we are still in a pandemic, so we will go ahead and continue to share some of these updates as they pertain to you, as well as information on the stabilization grants. This application is still open. And we want to share more about how the ELD works internally, right? We want to share a little bit more about what our functions are, what our organization looks like on the inside. I know that some of you all know your licensing specialist and get to interact with them quite a bit, but you might sometimes wonder who's behind the ELD. And so we are glad to be here today and allow you to meet some of the members of the Early Learning Division Executive Leadership Team as well. As always, after each of these topics, we will go ahead and leave room for questions. So if you have questions, please submit those through the Q&A in the Zoom chat box. And if you're listening through Facebook, please know that we are watching those comments as well. So you are also able to share comments and questions on the Facebook comment section. I think that's all we have for now in terms of ground setting. So again, thank you for joining us. I'll go ahead and pass it over to my colleague, Miriam Cecilia, to give us some updates on COVID-19. Thank you, Miriam.
Thanks. So no changes to the requirements or recommendations since our last meeting. Just a quick note about the ODE K-12 Test to Stay program. So this is a protocol not available to childcare programs at this time. It's only available to Oregon schools. And childcare programs should continue to follow the COVID-19 exclusion and notification protocols. So to exclude from childcare any child or staff member who tests positive or is susceptible and exposed to COVID-19 in accordance with local public health. Just a reminder, we still have the OHSU child care provider nurse hotline available for COVID questions. And the number is there listed, and we still have supply bundles available mask, gloves, disinfectant wipes, and baby wipes, and you can order those from the website.
Thank you. And this is, if there are any COVID specific related questions, please do put those in the chat and or in the Facebook comments, and we'll go ahead and get to those. If there are questions regarding COVID, we can also come back to them later in the presentation if need be. And I don't see any questions right now. So with that, we can, oh, actually, there's one question in here. So Ronnie, would you like to take lead? We have Ronnie Pham, who is our question master.
I am looking right now and I'm not seeing any questions at this time. Let me see. Okay, I do see a couple that, how many times can we order supply bundles? At this time, you can order that once and we will fulfill that for you. Programs. There's a question about how to get COVID tests for recorded programs. They're happy to pay for them, but they don't know how to get them. I don't have any information on that. Do you, Miriam?
I don't have any advice on how to get test kits. ELD is not supplying them. If you want, you can contact the provider contact email inbox. It's providercontact@ode.state.or.us. And I can try and help you locate some, but I would suggest also reaching out to local public health and seeing if they have any ideas. But like I said, ELD is not supplying test kits.
Thank you. There's also a couple questions around PPE and not seeing their orders. We have very few orders in that are not being fulfilled because the license number was entered incorrectly, and that's where we get the address. So if you are having problems with any PPE supplies, please send an email to eccgrants@state.or.us, and we can look into that for you. If and when a 5-year-old is fully vaccinated, do they need to be quarantined or can they stay in a class? I believe that is for you, Miriam.
Sure. And anyone that's fully vaccinated and it's been at least 2 weeks since their last shot does not have to quarantine if they're exposed to COVID. So only if they have symptoms would they need to quarantine.
Thank you. I was asked to repeat the email address for the grants. That is eccgrants@state.or.us. And what ages are required to wear a mask in a preschool setting?
So in preschools, 5-year-olds don't have to mask. It's attending kindergarten and older need to mask. I think there is a Head Start requirement that in Head Start ages 2 and up do need to mask. But in general, preschoolers do not.
Does this test to stay pertain to early education programs like 6 weeks to pre-K?
The Test to Stay program is for K-12 schools. So if you have a school-based program that's affiliated with a K-12 school, I would check with them, your school district, to find out if the early education portion of the program will have access to that program.
Thank you. Karina, we're recording all questions that are unanswered. So should we move on to make sure that we have time for the rest of the agenda items?
Yes, thank you, Ronnie, and thanks for that note. Yes, we are recording questions that are unanswered here, and we will do our best to follow up with emails and contact as promptly as possible. So please keep sending those in. And sorry, it sounds like one of our interpreters is coming through the English channel. Our Russian interpreter, if you could swap over to the Russian channel, I believe that was the one. All right, we will go ahead and transition over to Dawn for some updates on Child Care Stabilization Grants.
Hi, thank you, Karina. Good evening, everyone. My name is Dawn Taylor, and I'm leading the work on the stabilization grants, and want to just kind of remind people, I'm sure you're experiencing it, that this is a little different process, and so things are taking a little longer in terms of getting checks out. And so right now we are still having people submit applications. We're reviewing those for eligibility. Those that are approved, we are sending the approval email. And once we get you set up as a vendor in the state payment system, we then issue you a grant agreement, and then get the required signatures, and then begin sending out checks and issuing payments. A common question that we're getting in the inbox is people are from the funding opportunity. I believe it's on page 7. It states that these payments are in 2 payments. So you'll receive the first one, and then in the 4th month, or about, a little after 3 months after receiving your first payment, you will receive the 50% of and your final payment for those funds. So it is in 2 payments, and they're spread out kind of from the 1st month you receive it and getting it sometime in the 4th month. Wanted to share with you all just some general numbers in terms of how many people have been approved. And you can see here by type of care. Registered family has 884 approved applications, and this is as of November 22nd. ODHS license exempt providers have 316, certified centers 765, and certified families 759. And as you can see, we're still reviewing applications as they come in that are submitted. Also know that we are following up on people who maybe were not approved and they feel they should have been eligible. And with that, we're reviewing all of those. And particularly for the ODHS license exempt providers, we're following up with ODHS and the direct pay unit to kind of verify whether you're eligible or not. I think this chart shows that the vast majority of people who apply are approved. So you can see here in terms of the license care, it's well over 95% of all applications received are approved. There's a few more of the ODHS license exempt, and would believe some of it is that March 11th date for when the legislation was passed. But all in all, most people are being approved. Wanted to provide this grant contact information and also kind of address a few of the common questions that we're getting in the inbox. First, I also really want to encourage people that when you send an email or leave a message, please be sure that you have your license number or your ODHS provider number if you're a license exempt provider, and or your grant application. And really, we only need like the last 4 digits because it's a lot of zeros, and then the final 4 digits. And that really helps us answer the questions as quickly as possible. If we don't have enough information, some of you may have experienced we're needing to reply back and request that you send us your license number or ODHS number and or grant application. So if you can do that up front, that can save us time and be able to respond to you as quickly as possible. I think one of the common questions that we're also getting is that, people are at different stages of receiving, whether it's their DocuSign for their grant agreement, they're receiving their first payment. And so we're getting a lot of questions of, my friend got her check, where's mine? And so a lot of around the status. And so want to just kind of highlight that we're processing a lot of both application, grant agreements, and now payments, and all of that takes some time to get those processes ready, as particularly when then we hand them off to other parts to do the payments. So please don't be worried that there's maybe something wrong with your application or your grant if you haven't received your payment, but your friend down the road has. You just know that we're working through the process. I think the other thing that is important to note is that when checks are mailed, they're mailed in bulk mail. And so that actually takes longer than like if I was just to send you a letter in the mail. It goes from ODE, then to the US Postal Service, and that bulk process is takes longer. So that can add to that time of receiving your checks. Want to encourage people that if you're needing help in completing the grant or needing even and needing support and how to do the record keeping for this grant, really encourage you to look at our website for some key resources, as well as contact your local CCR&R that are set up to help you develop some record keeping and how to document your expenses. And I'm happy to take any questions.
Thank you, Dawn. So we're seeing a lot of questions again about will the grant funds come in a check or direct deposit?
So the majority of the checks will be coming through the United States Postal Service in a check. If you have signed up for direct deposit through DAS, our Department of Administrative Services, then you would get it via a direct deposit. I think it's important to note that if you're set up for direct deposit with ODHS, like through the direct pay unit, that is a different payment system than we use for the grants. So just because you're signed up to receive your provider payments for your childcare subsidy for direct deposit, that doesn't mean that you're set up for these grant checks. So unless you reached out to Department of Administrative Services, and get that set up, you will receive a paper check.
How does a participant find their grant number?
Yeah, so your grant number, you can find it in a couple places. One, it would be on an email that you received from us for your approval. It would also be on your grant agreement that we sent you via DocuSign. And you could also log into SM Apply and you could find your grant number there.
Thank you. Can you talk about the significance of the April dates in relation to the grant funds being expended?
Yeah, so I think the question is around, the vast majority, the people who receive their grant agreements in November, their end date is April 30 of 2022. So all funds need to be expended by that date. I think it's important to note that funds, however, you can go back and essentially repay yourself from January 31 of 2020 until April 30, 2022. Grant agreements that go out in December will have a May 31 end date.
Thank you, Dawn. Let me see. And Dawn, can you just please provide the email for them to get additional questions if they didn't get them answered tonight?
Certainly, it's right up on the screen. It's ecc-grants@state.or.us. And please do give us 2 to 3 business days in order to get back with you. We have a small but mighty team working on getting answers, but it's a pretty active inbox. So please be patient with us as we get back to you. Also important to note, You know, if you leave a message, we will get that message, or if you leave an email. So don't feel that you need to send both necessarily. I know sometimes I'm calling providers back. It's like, oh, I already got an email. So really just reaching out in one of those venues would be great.
Thank you.
Thank you, Dawn, for all of this great information. I do want to just put out a reminder that our chat is not activated right now. We are using the question and answer feature. So please use it looks like two little message bubbles below on the screen. Use those to ask questions. And we are getting to those as we, through answering live. And like we have said, we can also follow up with emails or contact later if we don't get to your question today, but just want to make sure that we all know that the chat is turned off for now. And if you're on Facebook, again, please do ask your questions there. With that, we'll go ahead and move over to our executive team. So we're going to actually pass it off to our director, Alyssa Chatterjee, who will introduce herself once more and will also introduce us to the rest of the executive team who was able to make it tonight. So thank you, Alyssa, for being with us. And
Thank you. Thank you. Good evening, everyone. Thanks so much for taking some time. Some of you have probably heard me a few times before, but if not, my name is Alyssa Chatterjee, and I'm the Early Learning System Director with the Early Learning Division. I wanted to just share a little bit about myself, but I'm really excited. We've got a lot of folks from our executive leadership team here with us today, and really excited for you to learn a little bit more about what we're doing at the Early Learning Division. But I first joined the ELD back in 2012 as the assistant to the first Early Learning System Director at the time. I did leave for a couple of years to serve as the governor's early learning policy advisor, but came back in May, and I'm really excited to be back with the team and working with so many of you all, and just a lot of great work coming up. So that's a little bit about me, but on to the exciting stuff. On the next slide, you'll see our current organizational structure. So I know, as Karina mentioned, a lot of you engage with your licensing specialists or maybe engage with other staff in the Office of Child Care, but there's a couple other units that exist within the Early Learning Division. So we wanted to really take this opportunity to share a little bit more about our current teams and responsibilities, so that you have a little bit of a framework of where we are as we talk more in the future about where we're going. I know in previous sessions I've mentioned that House Bill 3073 passed in June of this year, and this establishes the Department of Early Learning and Care. So we've been working hard to start to prepare for that transition, and wanted to kind of let you know where we are right now, but we'll be inviting brainstorming about what this future agency could entail. So tonight you have a chance to meet some members of our executive leadership team, and they're going to share a little bit more about themselves and their work. So with that, I'm going to turn things over to Dr. Khan, our Chief of Staff and Interim OCC Director.
Thank you, Alyssa. Good evening, everyone. My name is Nasrin Khan. I'm the Chief of Staff and Interim Director for the Office of Child Care. I have experience working both in private and public sector, but majority of my work has been with the state of Oregon. I have worked in various agencies such as Oregon Department of Human Services, Oregon Health Authority, Department of Consumer and Business Services, and then I joined Early Learning Division in August of this year. My background is in organization development, strategic planning, project portfolio management, workforce development, and setting up systems. I moved from India in 1999 to Oregon, and from there we moved on to East Coast for a few years before moving back to Oregon to make this our permanent home. I have an MBA in information management and doctorate in healthcare systems, organization development, and leadership. Next slide, please. So in my role as the Chief of Staff, it's to support the effective decision-making and execution of strategic initiatives across all functions. My goal is to organize ideas, people, time, and resources necessary to keep everything moving forward. Also, I'm focused on the future and on long-term planning to provide the organizational and communication framework for every staff and leadership team members to implement our Director Alyssa Chatterjee's vision and achieve agency goals. Next slide, please. So in my role as the Interim OCC Director, I supervise the Office of Child Care Management team, which is comprised of field operations, legal compliance and enforcement unit, and quality assurance. The position is responsible for advancing goals related to safety, child safety, and partnership with providers to implement best practices and to streamline processes, lead the development of policy, procedure, and regulations related to child care licensing, ensure compliance with applicable state and federal laws, establish systems that ensure consistent and equitable monitoring and enforcement, and finally, supporting the quality assurance and continuous improvement. Next slide, please. With that, I'll pass it on to my colleague, David Mandel, our Chief of Policy and Research.
Thank you, Dr. Khan. So my name is David Mandel. I'm Chief of Policy and Research. Also just want to thank everyone for joining us this evening. You know, I know that you all work so hard and are so busy, so we really appreciate your time. And so also really appreciate this opportunity just to introduce ourselves to you a little bit more. I've been with the Early Learning Division since 2014, so came a little bit after Alyssa, and you know, been working in various roles around policy and research during that time. Before joining the Early Learning Division, I to Speaker Coates as the Director of Policy and Research there. Next slide. So this is the team I work with and the role that we play in the Early Learning Division. So my team works on developing policy, working with the legislature, and we also work on research projects to really make sure that we're understanding what are the needs of families, of providers. So if you receive some surveys in the past, those may have come from our team. And then our team also works on childcare policy. A lot of that is around federal regulations. So Oregon receives a pretty significant investment through the Child Care Development Fund. And there's a lot of rules and regulations that cover everything from licensing rules and background checks to subsidy policy. So we do a lot of work with the federal government to make sure that we're following all those rules and that they know that we're following those rules.
A little bit.
And then our team also, am I breaking up?
You're breaking up a little bit. If you want to back up a few sentences. I'm going to
turn off my camera just to see if that.
Thank you.
Oh, I'm sorry. My apologies. The hard thing about breaking up is you don't know what came through and what didn't come through. So I apologize for that. Our team also works on childcare policy, you know, making sure that we're following all of those federal regulations. And then we also work really closely with our Early Learning Council. The Early Learning Council has a really broad responsibility for setting strategy and ensuring the implementation of Raise Up Oregon. And in addition to that, they are also our rulemaking body. So all of the formal rules, including all of the childcare licensing rules, need to be voted on by the Early Learning Council. So the policy and research team also works with Office of Child Care when it's time for licensing rules, or with the program team to work on those rule sets, to work with stakeholders, to make sure that the rules as they're being developed are really informed by what families and providers and communities need, and then to work with the council to get those rules adopted. And I think with that, I think I hand it back over to Alyssa. Oh, no, to Jared, I'm sorry.
Nope, you're good. Thanks, David. So wanted to share a little bit about the Chief Operating Officer role. So this role is actually going to be vacant after this week. So we'll be hiring for that position early next year. But the Chief Operating Officer is really focused on a lot of these internal processes that support the early learning division. So this is where we have work with our human resources team. They oversee budget and accounting to make sure that we kind of know how much money we have to spend and that we're spending resources appropriately. And our grants team is really critical because they provide a lot of support to the teams that are issuing things like preschool promise grants. So a lot of exciting work and really important work there that folks don't necessarily get to see a lot of all the time. And then it also is home to our Chief Information Officer and IT work, which is also critically important. And so I'm going to hand that over to Jared.
Hello. Good evening, and thank you for attending the call. I want to echo David's comments. It's really great being engaged in the conversation. My name is Jared Chalk. I'm the Chief Information Officer, or CIO, for the Early Learning Division. And unlike a lot of the other folks, I joined ELD just probably about 3 months ago. So I'm still pretty new on the team. As the Chief Information Officer, I'm responsible for ensuring the information technology and data systems are accessible, secure, efficient, and effective. And just to provide a little bit of background about me, I've lived in Oregon for a bit over a decade, and I come to the Pacific Northwest by way of Montana. So I've got a little logo over there for the University of Montana, where I earned my undergraduate degree in psychology and returned later for a master's in business administration. I worked for the state of Montana and also at a nonprofit grant and federal student loan servicing organization, Student Assistance Foundation. I moved to Oregon and accepted a position with Chariots, or what you might know as Salem Kaiser Transit, around 2010, and I led strategic planning, route design, as well as information technology there. But for the past 6 years, I've been working for the state of Oregon with Enterprise Information Services, or what was previously called the Office of the State CIO. There I was a strategic technology officer and senior IT portfolio manager. So I worked with agencies to engage on long-term IT planning, oversight processes, things like that. We can go to the next slide. So enough about me. Some of the core services that we offer in information technology include administration. That's just the running of the core systems that keep the computers running, but also our online systems and our data tracking systems. Business analysis, meaning understanding what the business is doing and trying to translate that into technology. Disaster recovery, to make sure that things work in the event of a disaster. Lifecycle management, that means replacing core infrastructure and equipment, planning for the future. We manage projects, we ensure that everything is secure, and we provide support to the users of our systems. Next slide, please. So in our technology area, we have a lot of foundational work to do ahead of us, including replacing core legacy systems, expanding online capability, mobile operations, things like that. And as we plan for that work, we've created a few guiding principles, and those are listed here. Being business driven, we're going to strive to understand the business and help ensure that we have solutions that are effective. We're going to focus on security. We're going to use cloud services to try to be quick and cost effective. We're going to focus on the relationships that we build so that we can be the most efficient. And we're going to rely heavily on our partnerships. So that's a bit about IT, kind of some of the core services that we provide and some of the principles that we're going to use as we try to build out going forward. And so I think now I pass it on to Alyssa.
Thanks, Jared. So another team that we have in the early learning division is the programs team. Our chief of programs is another vacant position. So if you or someone you know is just a really strong system thinker and loves early learning programs, we'll have that job posting in January as well, and would love you to throw your hat in the ring. But this team is broken up into 2 units: community systems and program design and delivery. And as you can see here, there's a lot kind of packed into these 2 systems. So community systems has our professional learning team that's really focused on working with childcare resource and referrals, you'll see here, providing coaching and training, and really working on those supports for you all in the field. We also have our parenting education work that lives here, working a lot with the OPEC hubs, the Oregon Parenting Education hubs across the state. They work with our early learning hubs, our 16 hubs, as well as support coordinated enrollment, which some of you might have heard of if you're a preschool promise provider. Our program design and delivery team is where our programs live. So this is where you'll see Preschool Promise, Baby Promise, our home visiting program, Healthy Families Oregon, and our Oregon Pre-Kindergarten Head Start program. So another really important function within the early learning division that we just wanted to share a little bit more about with you. And you can go to the next slide. So thank you. Just really big thanks to Jared, Dr. Khan, to David for being here this evening and sharing a little bit about your teams. And again, for you all tuning in to learn more about the early learning division. There are so many more people and sub teams who support this work, support you, support our children and families, and we'll have opportunities for you to meet them in future meetings as we kind of dig deeper. But wanted you to have kind of one last snapshot of the teams we've walked through with you all today, and really looking forward to coming back and getting more folks in front of you so that you can get a better sense of who all's working here at the early learning division. Next slide, please. So I know I've mentioned it, but as we're designing the Department of Early Learning and Care, we really just wanted to share a little bit about kind of where we are in this process, but more than that, share that we will be doing a lot more work with you all later this year, but especially in the spring of 2022. So be on the lookout for engagement surveys, for opportunities to join focus groups, and other ways to stay engaged in this work. You can see through this really high level timeline that we're pretty in the middle of this transition. So we've been working really hard since last spring to get ready for the legislative short session in February. We'll have a lot more to share with you after that session happens. And if you want more information on what's happening with this work, you can go to our website that's listed here on the slide. And we're just looking forward to sharing more with you. So I think that is it for me, and I'll turn it back over to you, Karina.
Thank you, Alyssa. I really appreciate it. And I'm so thankful for everyone from the executive team who was able to join us this evening. I think it's really important that we see some of the faces that are working behind the scenes, and just so that we know, right, that there is folks really invested in this work as well, and wanting to support our providers and children all across the state. We have one question that has come through that makes me think of this transition, and it says, the search bar on the ELD website is not friendly. Are there any changes, any plans to adjust that? So I think we might have someone on the team who might be able to answer that, but short answer is we have a lot of updates coming and plans for updates, and that includes a website at some point, although I don't have the exact timeline for that. So we know that this is really important. We do encourage you all to check out our website, navigate it, search things. There's great information there. You can find links to the Child Care Stabilization Grants, COVID updates there as well. There is a link that we have on the slide deck that you will be able to find on our website later, but this link is to sign up for our childcare updates to receive notifications and news as promptly as well. So please do check those out. We have some time here, so I'd like for us to maybe take a couple more minutes to go back on some of the questions, look back at questions that have come through, and maybe I can hand it over to Ronnie to go through some of these. I know we still have Miriam on the line and Dawn to answer questions regarding COVID and grants, since there are so many of them, and we just want to make sure that we take this time, some more time for that. So Ronnie, are you on board for a few more questions?
Sure. So for COVID questions, they were wondering if we had any information on the booster for childcare providers. Is it required or recommended?
The booster is not required. There are no requirements for vaccination for childcare providers other than those that are school-based. I can't speak to the recommendation. I guess I'm just not prepared to speak to that.
Okay. Thank you, Miriam. If a childcare program is in a school, located in a school, do they follow the K-12 test to stay protocols or the Office of Child Care protocols?
If they have access to the K-12 test to stay program, they can use those protocols. Otherwise, they would need to continue to exclude as per ELD requirements.
Thank you. I think this question is for Alyssa. So can you talk a little bit about how the Early Learning Council gets its information about childcare settings so they could intimately respond to the issues coming before them?
Absolutely. And I invite David to jump in on this as well. The Early Learning Council meetings are public meetings, so folks are always welcome to submit testimony, since I know it's really difficult to join these meetings in the middle of the day, but you're also welcome to join virtually for verbal testimony. But we get our information in a few different ways. As David mentioned, our research team is often conducting surveys or working with partners like Oregon State University to do deeper dive studies to provide information to the Early Learning Council to help inform their decisions. Anytime that they're adopting rules, whether it's for childcare licensing or if it's for preschool promise, we always convene what's called a rulemaking advisory committee. And this is a table that is able to, folks are able to apply to sit on it and give input and help us craft any changes to rules. These rules are also always available for public comment, and we always host a public forum where folks are welcome to join again virtually and share their comments in written form or verbally in those spaces. And that feedback is also shared with the council. David, did I miss anything there?
No, I think that was great, Alyssa. And folks are always also welcome to submit written testimony on any topic that they think is important to the council. I think there's information on our website around that. So, I think the council is always really interested in hearing from folks and hearing from providers.
Okay, thank you. We also have some questions around the grants. Dawn, can you speak to the issue around the grants needing to be expended by April 2022 and talk about that timeline a little bit more?
Yeah, so the grant agreements are going to be for a 6-month period of time. So for those who were awarded in November, your grant agreement goes from November until November, December, January, February, March. Yeah, April 30 of 2021 or of 2022. The way this legislation was passed is that you can go back and reimburse yourself for past expenses. And so those past expenses can go back to January 31 of 2020. So for any expenses that you had that maybe weren't covered by another emergency grant that you received, within your grant agreement, there's allowable expenses from rent, mortgage, lease, increasing accessibility, supplies, cleaning. So you're able, personnel costs. So you're able to go through and look at your funds from a much broader period than those 6 months, from that 6-month period of time. I believe I saw a comment or a question in there kind of talking about we received the money in March and we have to spend it by April. I think it's important to remember you're able to kind of plan what you're going to be doing and be able to go back to January 31 of 2020.
Thank you, Dawn. Can you talk about taxes and grants?
Yeah, well, at the Early Learning Division, we don't provide tax advice for really specific advice because everyone's situation is different. You really need to seek a tax advisor that you may use. But I can say that these funds are not exempt from being taxable. So you will receive a 1099 NEC at the end of the year. And so it really depends on your tax situation in terms of how they will impact your taxes.
Thank you. So can you talk about the deadline for the stabilization grants, and will there be any extensions to that deadline?
Yeah, so currently the deadline is December 31st at 2021 at 5 p.m. Pacific Standard Time. I think we are exploring what if there's some additional funds that maybe weren't expended, but we at this time are not sure what that might look like or where we're even going to sit in terms of having the funds out until December 31.
Thank you. Can you talk a little bit about the 20% increase for the compensation for staff? Is this a one-time? How can this be done?
Yeah, so one of the requirements of the grant, as this person mentioned, is that 20% of your total funds must be used to increase compensation for your staff. Compensation can be done in a number of ways. It's really up to each program to determine the best way that you are looking to increase compensation for your staff. And I think it's important for family providers to really think about that you are also staff. And so increasing your compensation as well. And so there's no requirements in terms of increasing wages, bonuses, retention bonuses, hiring bonuses. It's really whatever makes sense for your program and where they're at for a way to make sure that you and your staff are also having some additional support during the pandemic of having some additional compensation.
Thank you. We also had a question. I believe this would be for Alyssa. Can you explain a little bit about what universal childcare might mean in Oregon?
Well, this could be a whole session in itself. It's really exciting. We know a few things. So Build Back Better has a universal preschool proposal, which would mean that all 3- and 4-year-olds get access to preschool. This would likely happen at least over the course of 6 years, if not more. There would be no income requirement there once the program is fully up and running. There is also an expanded childcare assistance program. This would be a birth to 5 program, so it's different than ERDC. It would still have an employment component, but it would be up to 250% of state median income. And David, correct me if I'm getting my numbers wrong, but I believe for a family of 4, that means making $130,000 or less, you would qualify for this program, meaning that as a parent, you wouldn't pay more than 7% of your income. So it's really exciting. We are still waiting to see if Build Back Better passes, obviously, but we know that it will be incredibly important to make sure that childcare providers are supported to expand their programs if they're interested. We'll have to do a lot of work to recruit new providers to make sure we have enough childcare to be able to meet this need and meet the level of service that we would want to be able to provide to meet the universal preschool model, which is mixed delivery. So it'd be similar to Preschool Promise in that school districts, Head Start programs, home-based and center-based childcare providers would all be eligible and critically important to the success of that program. And similarly with the child care assistance program, we would really want to make sure that providers have what they need to be eligible to become a provider that receives those services to support families as well. So hopefully we'll see that pass and we'll have a lot more to share next year. But thank you for that question.
Thank you. Alyssa, how would recorded programs fit into that new thinking?
A great question. This is one of the things that I think we still need a little bit of guidance from the Administration for Children and Families on. Oregon's a little bit unique in having this recorded program designation. So what we do know is that the Child Care Assistance Program does look like it will only be available to licensed programs. So that is one of the things we have to figure out. We've been in a lot of conversation about creating school age licensed rules. This is actually a requirement of House Bill 3073 that also creates this new department. So we're hopeful that there will be a path to help recorded programs have access to these funds through licensure if Build Back Better passes.
Thank you. So we have more grant questions. If you have received previous grants, are you automatically set up as a vendor?
It will depend is if you've had any information change. So if you have moved, changed your last name, then you would need to complete another W-9 form. But if you have received an emergency childcare from us in the past and none of your information has changed, then you don't need to complete a W-9. We have one on file for you.
Thank you. So how long does it take for the process once you complete your application and get an approval?
Yeah, that's a really not an easy question to answer directly. And so I would answer it directly if I could. It really depends on kind of where you're at in terms of the state payment system. So once we, I guess once you sign the agreement, we're sending batches out for accounting. They've got to process them. And so we're estimating within 3 weeks of your grant application getting signed by both parties that you should be receiving a check. We do have the holidays and it is also taking a while to get, you can imagine with like 4,000 grant agreements, getting signatures and getting all those processed is taking some time. But that is what we're estimating that would be. I think the getting your grant, the DocuSign agreement, that's where it's really a lot harder to pinpoint a time. So if you're one of those people who have received an emergency grant from us before, your W-9 information is good, you're already set up as a vendor in the system, and we're able to move those through. If there's work we have to do, there's often some back and forth that we need to do. Whether like you're registered with the Secretary of State or your W-9 information isn't matching, that's when things can take a little time. And it's just as we work to problem solve that with you.
Thank you. So I think this might be for Miriam. Now that Head Starts are requiring 2-year-olds and older to wear a mask, as well as staff to be vaccinated or tested weekly, is that also going to happen in licensed programs as well, or is this being discussed?
We have not gotten direction from Oregon Health Authority or the governor's office to make those changes at this time.
Thank you.
With that, Ronnie, I'd like to ask a question that was submitted in Spanish regarding vaccines as well. And let me find it. It says, is it all right if parents decide not to vaccinate their children who are 5 and older, or 6 and older, since that's what we know is allowed? Or do we need to request that they do so? So regarding vaccines?
There's no vaccination requirement in terms of what ELD or OHA requires for children. It would be a business decision if that was what your business would require. I would suggest that you make that decision and communicate it to all families so that they all know what the policy is.
Thank you. Karina, did you have others that you wanted to ask at this time?
It looks like most have been asked in English as well and answered. So,
okay, thank you.
Thank you.
Dawn, we had a couple questions around. So if individuals have already completed signing for their grant agreement and we have signed it and executed, will that mean that they get their first payment in December?
It would be, we're estimating within 3 weeks of when it's executed. So yes, we would be looking at December.
Okay. Can you talk about why the funding opportunity, the funding requirements aren't broader? Why are they limited to just those specific bullets?
I can't speak to the reasoning necessarily. I mean, the federal legislation was very specific in terms of how states were to use these funds. And so it's really around stabilizing the existing childcare sector. And so within the federal legislation, those categories that you're finding in your grant agreement are the exact categories that were a part of the federal legislation.
Thank you.
Thank you, Ronnie, for all of those questions, and for Miriam and Don and everyone else who's with us for sitting on the hot seat and responding to our listeners this evening. We know that this is an opportunity that we've had for about the last 3 months to share information with you all and also get direct questions from you. We have been watching the Facebook chat as well, and there is a question there about whether there will be a recording for this session. The answer is yes. We will upload a recording to our YouTube page in the coming day or two, and you'll also be able to see the recording on the Facebook page. So if you're joining us on Facebook, you'll be able to watch it there again. And if you want to go back and watch, feel free to join our Facebook page. The recording will be up there. With that, I think it's time for us to wrap it up. We again have some unanswered questions. We will try to get back to you as soon as possible. And as always, please feel free to send in your questions. We've dropped some links here with our Child Care Stabilization Grant email and others. And are there any last comments from Alyssa or others? If once we do exit the call, I do want to just note that there will be a survey link. So if you would please go ahead and join that survey and give us your thoughts about your thoughts regarding these webinars, but also comments or questions for us. And we'll take that feedback to inform future information sessions and future webinars. We really want to make this a space for us to be responsive to your questions and your needs. So use the survey, please, to do that. But also feel free to email our team with comments and suggestions. And I see Alyssa is on screen, so please go ahead.
Thank you, Karina. Just want to thank everybody again for making time out of your very long days right after some holidays to spend time with us, and really encourage you to respond to that survey. We want to make sure that these webinars are useful and that we're touching on topics that are of interest to you. So we really do appreciate your feedback, and we definitely use it to inform our time with you. So thank you for taking the time to do that and for joining us again.
Thank you, everyone. Have a wonderful evening.